Do not pay for another dental course because I already did it for you. This is part 2 of the series where I share everything I learned in a $200 phone course. And let me tell you, implementing this at your office could be the difference between an $800 office and $1 million office. In this video, we're going to break down how the tone you use on the phone calls directly impacts whether the patient schedules or not, how to evaluate your current tone, and how to create a simple guideline so the entire team delivers a consistent, high-quality patient experience from the very first call. And to help this all make sense, I'll share a few examples at the end so you could hear what this actually sounds like in a conversation.
Operator punchline, biting into the latest in dental innovation. You're with the operator.
Why is this important? Think about it like this. If you walk into a store and somebody greets you with energy, warmth, confidence, you immediately feel more comfortable. You're more likely to trust them and more likely to buy. If somebody sounds bored and distracted and interrupted, you start looking for the exit. The exact same thing happens on the phone. You are the very first impression of your practice. And whether you realize it or not, patients are forming an opinion about your team within the first few seconds of that conversation. Your tone, whether it's warm, welcoming, rushed, distracted, sends a clear message about what it's actually like to work with your practice. Another quick example. Imagine calling 2 offices. One answers, "Dental office, please hold," while the other one says, "Hi, thanks for calling. This is Sarah. How could I help you today?" Same service, completely different experience. And that difference alone could decide who gets the appointment. So let's start with a simple question. When you or someone at your office picks up the phone, what does it actually sound like? Take a moment to really think about it. And if you could go back and listen to the real conversations, whether it's your own or your team's, if you are using a system like a VoIP phone or call recording, this becomes really easy. And if you're not already using it, I highly recommend that you do set that up because it gives you a much clearer picture of what the patients are actually experiencing. And then ask yourself, does this actually match the experience we want our patients to have? If not, what should it sound like? To help you evaluate, ask yourself, how much energy are you bringing into the call? What kind of tone are you using? Is it friendly, enthusiastic, neutral, caring, or something else? And how you're communicating the value of your practice. Now, there isn't one perfect answer here. No one is 100% consistent all the times. We have some days where we have more energy, some days we're tired and stressed, or just ready for the weekend. That's normal. The goal isn't perfection, rather awareness. Right now, you're just trying to understand your baseline so you could decide what you want to improve. You could also be thinking about your practice's goals, core values, and how you want those information to come across in the phone calls. For example, if one of your top goals is to create a 5-star patient experience, ask yourself whether that experience is starting from the very first phone call. Does the way your team answer the phone reflect that? You should also think about your USP, your unique selling proposition. In other words, what sets your practice apart from another office in the area or down the street? Maybe you offer the latest technology. Maybe your team is especially warm and welcoming. Maybe your doctor has advanced credentials or specific expertise. So why does that matter on a new patient phone call? Because if somebody has already been seeing your ads, your website, your social media, they already have a first impression of your practice. And when they give you a call, you have to enforce that. It should feel consistent with the brand and experience you're promising everywhere else. And that's what helps patients remember you, trust you, and feel like they're calling the right place. Because once you do, you're creating tone guidelines your whole team could follow. It could be a simple 1-page. And to make that easier, I've included a sample template in the description below. As you build out your own guidelines, make sure to get input from your team as well. So how do you implement it? First, make sure that everyone who answers the phone is familiar with these guidelines. That means everyone reads them and understands them. And more importantly, the entire team, including yourself, should be aligned on the same tone. Next, you need to practice it. One of the best ways is to do a simple role-playing exercises, pair up with a teammate, and go through different scenarios. Have one act as a patient and the other respond using the tone Keep it light, make it fun, but stay intentional. The goal is to build confidence and make sure this feels natural over time. Think of the tone as something you're continuously refining. The more you practice it, the more natural it will become. Now that we've talked about what the right tone looks like and how to implement it, let's hear what it actually sounds like in real life conversations. I'm going to walk you through a few examples so you could hear the difference between a strong, effective tone and one that might be costing you some appointments.
Good afternoon. This is Robin. How can I help you?
Hi, Robin. I'm just trying to find out around about how much you guys charge for a porcelain ceramic crown.
We usually don't give prices over the phone.
Okay. All right.
Are you a
thank
patient here, or?
Depends on how much it costs.
Yeah, we don't give prices over the phone.
Okay. No problem. Thank you.
Okay. Thank you. Bye-bye.
This is Chloe. How may I help you?
Hi, Chloe. I was calling to hopefully set up an appointment.
Okay, wonderful. Are you a current patient of ours?
I am not, no.
Not a problem. Who do I have the pleasure of speaking with today?
My name is...
Just in case we are disconnected, what's a good contact number for you?
Yeah, Abby.
Wonderful. How did you hear about our office?
Honestly, just went on Google and, dentist near me, and you were one of the first ones to pop up.
Oh, perfect. Are you having any pain or dental concerns at the moment?
A little sensitivity, yeah.
Okay. Is it in any specific part of your mouth, the left or the right side, upper or lower?
Yeah, I would say for the most part, it's like the top back left.
Okay. Would you prefer a morning or an afternoon appointment for your free new patient exam and x-rays? I do have an opening today if that's not too soon.
Oh, no, because with work I'm kind of busy. I was hoping for either next Monday or Tuesday, and the timing honestly didn't matter. I guess preferably morning, but...
Yeah, absolutely. Would you prefer Monday or Tuesday?
Let's go with Monday.
Monday? Okay. Right now, the earliest appointment I have available on Monday is going to be at 11 a.m. I also have an 11:40 a.m. If you'd need something earlier than that, I have a 7:40 a.m. on Tuesday.
11 on Monday that should work.
Hopefully you heard what a good versus a bad tone sounded like. In the next video, we're getting more technical. I'll show you exactly how to handle tricky questions, overcome objections, navigate pricing conversation, and guide the patient towards scheduling an appointment. If you found this video helpful, make sure to give us a like or subscribe, and I'll see you in the next video.